Mat activities involve both movement and stability, ranging from simple motions to complex combinations like crawling. These activities are performed in various positions to enhance function, control abnormal movements, and make therapy engaging. Mat activities embody the PNF philosophy, allowing patients to start with strong, pain-free movements and progress towards improving weaker functions. The main goals of mat activities are to teach and practice functional movements, train stability in different positions, increase coordination, strengthen functional activities, improve joint and muscle mobility, and normalize muscle tone. Motor control in mat activities progresses through 4 stages: mobility, ability to assume a posture and initiate movement; stability, maintaining a static position and controlling gravity; controlled mobility, moving within a stable position; and skill, manipulating the environment with dynamic proximal stability. Therapists use basic procedures such as approximation, traction, stretch, correct grips, resistance, and clear commands to enhance patient performance. Techniques are selected based on the emphasis: stabilizing reversal and rhythmic stabilization for stability, combination of isotonics, rhythmic initiation, dynamic reversals, and repeated stretch for mobility, and a combination for skill. Mat activities include prone and supine exercises such as rolling, prone on elbows, quadruped, kneeling, half kneeling, hands and feet position, and various sitting and standing transitions. These activities are tailored to patient needs and functional goals. Rolling is both a functional activity and a full-body exercise. Therapists facilitate rolling using combinations of scapular, pelvic, neck, or extremity motions. Resistance and specific commands help reinforce desired movements. Rolling can be performed forward or backward using different muscle patterns. Specific scapular and pelvic patterns facilitate rolling. For example, anterior elevation and depression of the scapula or pelvis help roll forward, while posterior elevation and depression help roll back. Commands and resistance are tailored to these patterns. The arms and legs can be used as handles to facilitate rolling and strengthen trunk muscles. Different movement patterns and resistance techniques are applied to the extremities, with the head moving in the direction of the roll. Bilateral combinations of arms or legs, as well as neck patterns, can facilitate rolling when other motions are limited. These techniques use traction or compression and are tailored to the patient's abilities. Prone on elbows is ideal for working on head, neck, and shoulder stability. It allows for resisted neck and arm motions, strengthening both the moving and weight-bearing sides. This position also benefits facial muscles and swallowing. Side sitting is an intermediate position between lying and sitting, involving weight-bearing through one side. It is useful for exercising scapular and pelvic patterns, promoting trunk mobility and stability, and practicing functional activities like scooting. The quadruped position allows patients to exercise their trunk, hips, knees, and shoulders. It is functional for moving on the floor and is especially useful when spinal pain or stabilization is an issue. Techniques like stabilizing reversals and rhythmic stabilization are used for trunk and joint stability. Kneeling and half-kneeling positions are used to exercise the trunk, hips, and knees, and to practice transitions to standing. These positions challenge balance, coordination, and strength, and are adapted based on patient needs. Transitioning from the hands and feet, arched, position to standing and back is essential for patients with extended knees, such as those with leg braces or prostheses. This activity requires full hamstring length and is functional for getting up from the floor. Long sitting and short sitting positions are used for functional activities like eating, dressing, and transfers. These positions allow for balance training, pushing up exercises, and strengthening of the arms, trunk, and hips. Bridging in the hook-lying position strengthens the trunk and lower extremities. It involves lifting the pelvis, rotating the lower trunk, and can be performed on 2 legs, 1 leg, or with arm support. These exercises improve anti-gravity control and functional mobility. Mat activities are adapted for various patient conditions, such as limited shoulder range of motion, incomplete paraplegia, ankylosing spondylitis, and incomplete tetraplegia with brachial plexus lesion. Each case demonstrates specific exercises and adaptations to meet individual needs.